Hi! In today's video, we are going to talk about the anatomy of the eye using this amazing model. What better way to learn about the anatomy of the eye than being able to use a really nice 3D model to be able to point out the different parts of the eye and then let you know what they're called. I'm Dr. Vanessa, and this is my channel, Learning Biology with Dr. Vanessa. I just want to take a minute and say, if you are enjoying these easy to understand videos, please make sure that you join my community by clicking on that subscribe button. All right, so the eye model that we're going to take a look at looks just like the eye would look if we were to take it out of the socket, but it is about 7 times as large as the eye. So we can really get a good look at what all the different parts of the eye look like. So the first thing that you'll notice if we're looking at the outside of the eye is that there are several different muscles that are going to be surrounding the eye. So we'll pop this up off of the stand so that we can take a better look. There are several different muscles that all are on the outside of the eye. This helps us move our eye in different directions. So we have the superior rectus up on top, superior. If you've seen my anatomical terminology videos, you'll notice that this is the top part would be superior. The bottom part would then be the inferior rectus. And then depending on which eye this is, we have the medial rectus and the lateral rectus. Okay, so how do we know which is which? The medial would be towards the midline, the medial rectus, and the lateral rectus would be the muscle on the other side. So the superior helps move the eye up, the inferior helps move the eye down, the medial towards the nose, and then the lateral would move the eye towards the outside. There's 2 other muscles that are on the outside of the eye that we don't see here, and those are the superior and inferior oblique muscles that wrap around the eye, superior and inferior, top and bottom, and that allows the eyes to move in a rolling rotation. All right, let's continue to look at the different parts of the eye. So if we look at the front of the eye, we have right here in the very front of the eye is the cornea, and we'll take another look at that. So this covers the entire eye. The middle part that usually looks black is the pupil, and then surrounding that is the colored part of the eye, or the iris. You'll notice that the white of the eye is all here. The white of the eye is called the sclera. And then if we kind of go through and look at the different layers of the eye, we'll see the next one underneath the sclera would be what is called the choroid. So the choroid layer is right underneath the sclera, and then right underneath the choroid would be the next layer, which is the retina. And we're going to open up this eye and look at these a little more closely. The other thing you'll notice here are these veins that are coming into the choroid right here. These veins are called vorticose veins, and they are responsible for draining that choroid layer. All right, now let's open up this eye and take a look inside the eye and see the different parts. All right, so we pull this model in half, okay? And then we're going to take a look in here. So here we have the cornea. We already went through that, so that protects the front of the eye. We have the cornea, which is the clear portion that we can see right through. And then we have the iris, which is the colored portion of the eye. Right in the middle of the iris is where the pupil would be. And then right behind the iris, we have the lens. Now in front of the lens, we would have what is called aqueous humor. We don't see the aqueous humor here because that is a fluid area. So right in front of the lens, we would have this fluid area called the aqueous humor. Obviously this isn't filled with fluid in the front, but we would have that area. And then right behind that, we would have the lens. Behind the lens, we have a very larger fluid-filled portion. This is called the vitreous body. Now, the vitreous body isn't fluid like the aqueous humor. It's more of a gel-like fluid called vitreous humor. So it's more of a jelly-like component of fluid back here. Now, this helps to for the eye to keep its shape. And so it is filling the majority of the eye here. So we can take this out. I left the lens in here because I wanted to turn this on its side and just show you a little something here. So right in this area here, we have what is called the ciliary body or ciliary muscles in this area. And attached to the ciliary body would be what's called zonular fibers. And those zonular fibers attach to the lens, and they can actually help the lens adjust its shape, which helps you to see. And I'm going to make another video on how we see, and we're going to put all these different things together so that you can learn how we see. But we're going to continue on just with the anatomy in this video. So we have the ciliary body, zonular fibers, then attached to the lens right here. In this area right here, we have the ora serrata. And then all in the back of the eye, we have the retina. So if we kind of look here at the layers of the eye, what you'll notice is that we have the sclera, right? The white part of the eye. The dark part here is called the choroid, right underneath the sclera. And then we have the retina that surrounds the back of the eye. Now, the retina is how we see. The retina is formed of rods and cones, and they get the different colors in the light, and then they send the signal back to the back of the eye, and then which is where the optic nerve is, and that optic nerve then sends the signal to the occipital lobe of the brain, and then we see. So we're gonna, again, talk more about that in another video. You'll notice that there's also blue veins and red arteries back here. And they converge here onto the central retinal vein and the central retinal artery. So these are giving blood supply to the retina. The arteries are giving the blood supply, the oxygen, the nutrients that the retina needs, and then the veins are taking the deoxygenated blood and waste away from this area. So we do have arteries and veins in this area. What you'll also notice in this area right here, it's kind of a little more yellow than everything else. There's this circular area right here. That area is called the fovea centralis, and that lies right in the back of the eye right here. What is so unique about that is this is where you want light to hit directly so that we see at our with the best visual acuity. So when light hits this area perfect, we have 20/20 vision or even better sometimes, but our visual acuity is the best. So if you need any corrective type lenses, that's what they're doing. They're trying to correct the light coming in the eye so that it's hitting this area called the fovea centralis back here. The other thing that we have in the back of the eye is called the optic disc. So the way that we see, the retina has to send the information to the optic nerve, but the optic nerve actually kind of comes back down into the retina and blocks a portion of the retina, and that's referred to as the optic disc, and it creates a blind spot. So where the optic disc is, creates a blind spot in the eye. Okay. That concludes our lesson on the anatomy of the eye using this amazing model. Hopefully this was really helpful to be able to see the different parts of the eye using a model and being able to actually visualize it in this 3D manner rather than me just showing you on paper. If you really like this model, which is amazing, it has awesome vibrant colors, it's super durable, and it really is affordable. I'm going to put the link for this model in the description box below. Anatomy Warehouse so graciously sent me this model to be able to use for this video. I'm also going to use this in my next video on how we see. So you'll be seeing this model again in my next video. Again, if you want to be able to get your own, dropping that in the description box below, along with a discount code that you can use for your order. Thank you so much for watching my video. Thank you to Anatomy Warehouse for sending me this awesome model. And let me know in the comments below, did you like this video? Did you like me doing this video with this model? Are there any other topics you'd like to see in the near future? And of course, if you have any questions, drop them below also. Thank you.